Ever wondered why some people dread going to the dentist for a root canal treatment? It's often due to a handful of myths and misconceptions that swirl around endodontic treatment. One of the most common myths is that root canal treatment is painful. But with today's advanced technologies and anesthetics, most patients report feeling little to no pain during the procedure. It's quite the opposite of the old horror stories you may have heard. Another widely believed myth is that root canal treatment causes illnesses. This couldn't be further from the truth. In reality, endodontic treatment aims to eliminate bacteria from the infected roots of a tooth, promoting healing and saving the natural tooth from extraction. By eradicating these harmful bacteria, root canal treatment contributes to overall health rather than detracting from it. So, let's put these myths to rest. Now that we've debunked these myths, let's delve into what endodontic treatment actually entails. So, what exactly is endodontic treatment, commonly known as a root canal? You might have heard this term tossed around in dental conversations, but let's delve deeper to truly understand what it entails. Endodontic treatment is a specialized dental procedure that targets the infection at the very heart of a tooth. Now, imagine your tooth as a tiny fortress. Deep within its walls lies a soft tissue known as the pulp. This pulp is the lifeline of the tooth, housing vital blood vessels and nerves. Sometimes, due to decay or injury, this pulp becomes inflamed or infected. When this happens, it's like a castle under siege. That's where endodontic treatment, or the heroic root canal, comes into play. It's essentially a rescue mission, aiming to save the tooth by removing the inflamed or infected pulp, cleaning and disinfecting the inside of the tooth, and then filling and sealing it. Now that we've defined endodontic treatment, it's time to explore the procedure step by step. Endodontic treatment may sound complicated, but it's a straightforward process. Let's break it down into 4 easy-to-understand steps: access opening, cleaning and shaping, irrigation of canals, and obturation and final restoration. First up, the access opening. In this initial step, the dentist creates a small hole in the tooth to reach the pulp chamber, which houses the tooth's nerve and blood vessels. This is done using a dental drill, a tool known for its precision and efficiency. The purpose of this step is to provide a pathway into the tooth, allowing the dentist to perform the subsequent steps of the treatment. Next, we move on to cleaning and shaping. This step involves removing the damaged pulp from the tooth and then reshaping the canals. The dentist uses a series of small files to clean out the pulp and shape the canals to prepare them for filling. During this step, the dentist also removes any bacteria, reducing the risk of infection and ensuring that the tooth is ready for the next stage of the treatment. The third step is the irrigation of canals. This is a crucial step in the process, as it helps to clean out any remaining debris and bacteria from the canals. The dentist uses a special solution, typically sodium hypochlorite, to flush out the canals. This step ensures that the canals are thoroughly cleaned, which is essential for the success of the treatment. Finally, we reach the last step: obturation and final restoration. Obturation involves filling the cleaned and shaped canals with a rubber-like material called gutta percha. This substance helps to seal off the canals, preventing bacteria from re-entering and causing further damage. Once the canals are filled, the dentist then restores the tooth with a filling or a crown, depending on the extent of the damage. The final restoration step is important, as it restores the tooth's function and aesthetic, allowing you to chew and smile with confidence once again. In essence, endodontic treatment is a meticulous and systematic process that aims to save a tooth that has been severely damaged or decayed. Each step plays a vital role in the overall treatment, from the initial access opening to the final restoration. The tools used are designed for precision and effectiveness, ensuring that the treatment is as efficient and comfortable as possible. It's worth noting that while the treatment may seem complex, it's performed under local anesthesia, meaning you won't feel any pain during the process. And the result? A healthy, functioning tooth that can last a lifetime with proper care and regular checkups. And there you have it, a step-by-step breakdown of the endodontic treatment process. Let's recap the key points about endodontic treatment. This dental procedure plays a crucial role in preserving your natural teeth and preventing any further infections. It's a valuable tool in the arsenal of dental treatments, helping to maintain your oral health and overall well-being. Endodontic treatment, commonly known as a root canal, often gets a bad reputation. Many folks dread the mere mention of it. But here's the truth. Contrary to popular belief, a root canal is not a painful procedure. In fact, it's designed to relieve pain, not cause it. With today's advanced techniques and effective anesthesia, most people report that they're comfortable during the procedure. Another myth that's been floating around is that root canal treatment causes illness. This is simply not true. The purpose of a root canal is to remove the bacteria that cause infection and inflammation inside your tooth. It's a safe and effective procedure that eliminates bacteria and saves your natural tooth, which is always the best option. The process of endodontic treatment is broken down into several stages. First, an access opening is created to reach the infected pulp. This is followed by cleaning and shaping of the canals to remove the bacteria and prepare the space for filling. Next, the canals are irrigated to flush out any remaining debris. The cleaned canals are then filled or obturated to seal off the root canal system. Finally, a restoration is placed to protect the tooth and restore its function. In essence, endodontic treatment is a meticulously planned and executed procedure that aims to save your natural tooth, relieve you from pain, and prevent further infections. It's a testament to the advances in modern dentistry that allow us to preserve our natural teeth and enjoy a healthy smile. So next time you hear root canal, don't panic. Remember, it's a procedure designed to relieve you from pain and save your natural tooth.